Hi, this is part 3 of my weight loss surgery and thyroid cancer video blog. Um, so I left off, it was after I had my radiation. I couldn't walk for close to a year. And in that year, it was a very, very, very difficult time. I had to depend on my family for everything. Like I said, I couldn't go to the bathroom by myself. I couldn't put my clothes on. I couldn't take my clothes off. I couldn't take a shower. It took me an hour to get dressed. Going anywhere with the family. If we wanted to go somewhere, it took me about a good hour or more to get ready, just to get me dressed and up and out the door and in the car, and I was in a lot of pain, and I didn't know how to handle that, My kids and husband, they took over everything I was doing, My husband was working 2 jobs to help support the family, and I had lost my job, and it was a very stressful time. We ended up filing bankruptcy. I needed a bunch of tests, like PET scans and stuff like that, and my insurance wouldn't cover those, and just we had a lot of financial problems and medical issues, and between that and your thyroid hormone, if your thyroid levels aren't right, I was hypothyroid, and every 6 weeks I'd have to go and get tested, and they'd change my medications, and it just seemed like every 6 weeks that, the medicines were they couldn't get it right, and I was gaining, between that and the depression, and I couldn't walk, and between that and I couldn't exercise, and I wasn't as active as I was. I started gaining probably around 5 pounds a week, and I didn't stop gaining until until I got pregnant with my last child. And during the pregnancy, I didn't gain any weight, and the pregnancy actually stabilized my levels, and I had hit my highest weight, which was 279 pounds. It's hard to say. Whoever thought you'd get there, how did it happen? It just, I don't know, but it did. And my pregnancy was difficult, though, very difficult. I had a hard time getting up and out of chairs, and prior to that, after that initial year where I couldn't walk, I slowly started getting back, things back. I pushed myself to walk. I pushed myself to get out of the chair. I used a cane to get up, and with all my might, I pushed to get up, and it put a lot of muscle. It put a lot of strain on my stomach muscles, and I thought maybe I was getting a hernia or something. And then I had gotten pregnant, and after I delivered her, she was 10 pounds, 6 ounces. And I noticed that my stomach bulge didn't go away. And so I went to the doctor, and I said, look, I think I've got a hernia or something here. And so they sent me to the specialist, and the specialist said, look, it's like an abdominal weakening, and it's like a hernia, but it's not a hernia, and, we need to do surgery. You really, really need to have the surgery done. I'm not going to do the surgery on you, though, because you're overweight, and I want you to lose a good 100 pounds before I'll do the surgery. And he told me that if I didn't lose the weight and I didn't have the surgery, and we just left everything the way it was, he gave me between 5 and 10 years to live. Yeah. And he said, 5 years if you don't stop smoking, maybe 10 years if you stop smoking. You really need to have the surgery. And if I were to perform the surgery on you now, I'm afraid that you wouldn't make it through the surgery. And he said that the surgery required a lot of netting, and even if I made it through the surgery, that it was such a possibility for infection that he didn't think it was worth the risk. So he suggested I do this gastric bypass surgery, and so that's how we got this far. And I guess I'll leave this video here right now. Yeah. Thank you.